So this tutorial is about the middle cranial fossa. The middle cranial fossa is formed by the sphenoid and the temporal bone. It consists of a small median part and a lateral expanded part. The medial raised part is formed by the body of the sphenoid. Lateral expanded part lodges the concavities of the temporal lobe of the cerebral hemispheres. The middle cranial fossa is bounded anteriorly by the lesser wing of the sphenoid bone. Posteriorly, it's bounded by the superior border of the petrous part of the temporal bone and laterally by the squamous part of the temporal bone. The body of the sphenoid bone contains the sphenoidal air sinuses. So if I rotate this model anteriorly, so we've got this optic canals and they transmits the optic nerves and the ophthalmic artery, that's a branch of the internal carotid artery. Then we've got the superior orbital fissure. That's a slit-like opening between the lesser and greater ring of the sphenoid. So this orbital fissure transmits the lacrimal nerve, frontal nerve, trochlear nerve, oculomotor nerve, nasociliary nerve, abducent nerve, and the superior ophthalmic vein. Then we've got this foramen rotundum that transmits the maxillary nerve, and just after that we've got the foramen ovale that transmits large sensory and small motor nerve root of the mandibular nerve. Then we've got the foramen spinosum that transmits the middle meningeal artery. And then we've got this foramen lacerum that's irregular shaped and lies between the petrous part of the temporal bone and the sphenoid bone. Its inferior opening in life is filled with cartilage and fibrous tissue, so only the small blood vessels passes through it. The carotid canal also opens into the side of the foramen lacerum above the closed inferior opening. On the anterior surface of petrous part of temporal bone, we've got two grooves. So the large medial groove is for the greater petrosal nerve and the smallest lateral groove is for the lesser petrosal nerve. On the anterior surface of the petrous part of the temporal bone, we've got these rounded eminence and they're called the arcuate eminence. Then we've got the tegmen tympani that are the thin plates of the bone, that's the forward extension of the petrous part of the temporal bone and it adjoins the squamous part of the temporal bone and they form the roof of the mastoid antrum, tympanic cavity and auditory tube. So if I rotate this model to make you clear, that's the squamous part of the temporal bone and that's the petrous part of the temporal bone. Middle cranial fossa in the front, it also consists of the sulcus chiasmatic that's related to the optic chiasma and leads laterally to the optic canal on each side. And just behind to the sulcus, we've got this elevation called the tuberculum sellae. Behind this elevation, we've got a deep depression that's called the sella turica, which lodges the pituitary glands. So if I rotate this model to have a deeper look of this sella turica, so that's here the pituitary gland lies. The sella turica is bounded posteriorly by the square plates of the bone and that's called the dorsum sellae. So we've got this anterior clinoid processes and posteriorly we've got these posterior clinoid process and the cavernous sinus, they are directly related to the body of the sphenoid bone.